If you have sciatic pain, then I have 2 moves that you can do at home that's gonna stretch the nerve. So this video is dedicated to making sure that if you have sciatic pain that comes out of your low back, it could be traveling down your leg all the way to your foot, then what we're gonna do is we're gonna learn 2 moves that you can do at home that's gonna stretch the nerve. So either you're gonna get a tensioner or we're gonna slide the nerve. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with tips and tricks to help them live the life they were designed to live. Don't forget to like, subscribe, and share this information with the people we know need it the most. If you're getting that sciatic pain, so it's running down your leg, it's going to your toes, it's starting maybe in the low back, but now it's all the way down your leg. The problem with the sciatic nerve is it's a really thick nerve. And if you haven't seen some of my previous videos on some of the stretching that you can do at home, then please go ahead and click on those links and watch some of those videos. Today's video, we're gonna be focusing on stretching the nerve that actually comes out of the spine. So the sciatic nerve is a thick nerve. It's really thick, it runs down your leg. It's a collection of the nerves that come out of your low back. And what happens is, if that nerve becomes entrapped, meaning the nerve now no longer can move, it no longer has that ability to slide, it's become stuck, it's become irritated. One of the things that you can do at home is a specific stretch that allows for you to, and there's 2 types. There's one that allows it to slide, and so we're gonna go through a sliding technique, and the other one that we go through is a lengthening. So it's actually gonna pull on the nerve and break up anything that's stuck along it. So those are called adhesions. So we're gonna go through those. But the biggest thing that we have to look for is, if you're gonna try some of these, I would really recommend that if you increase, like if you're doing this and the pain is getting worse, or you're noticing that it's really not getting any better, please do not continue with this. This is general information. This is information that can serve so many more people, but it depends on your condition. It depends on what is happening in your spine and why you're getting the sciatica. For some people, it'll be a disc bulge. So in this case, you'll see here, if there's a disc bulge, so you'll see that red disc right there, and now the spine has stopped moving, it became super tight, and now it's irritating the nerve. Well, that would be a different reason for it, and therefore you would want to be under the management of a trained professional, whether it's your medical doctor, it could be a chiropractor such as myself, or it could be somebody like a physiotherapist, and there's a lot of other, but it depends on the area that you live in around the world. I know we're getting videos, or we're getting views from all around the world, and chiropractors are not necessarily accessible. If you live in our area and you're in this area, well, by all means, please go to a chiropractor, because with proper assessment, we can not only return the motion back to the spine, which is originally why the disc would have broken down, but more importantly, help with the alignment, reduce the pressure on the nerve, and therefore you're actually getting it at the source. And then you can use some of these tools to be able to stretch it. But this is really, really important to get this right, because a lot of these things are Band-Aid solutions. They are not gonna change the actual cause of it. They're just gonna help you while you have it. So these are 2 moves that you can try at home. And the best way to do this would be to be sitting down. So find something that's comfortable. You could do this on your bed, on a chair. And what you wanna do, so if you're getting sciatica and it's going down, in this case would be the right leg. So if it's coming down the right leg, what you wanna do is you're sitting down. The first step here would be so we're gonna lengthen the nerve. We're gonna be stretching it out. Now what's gonna happen is you're gonna bring your foot up. You're gonna toe curl towards you. So you're gonna bring your foot towards you. Right away, you should feel either the hamstrings, even your calf muscles. Those are gonna get a good stretch in that. So if it's too painful, what you could do is just bring it out there a little bit, but you wanna be able to get into this position. And then what you're gonna do is bring your torso forward. So now you're gonna get even more into the hamstrings, strings, you're gonna feel that. But then you wanna bend your head down. So you're bending your head down and you're curling your back. You're gonna hold this for about 10 seconds and then you're gonna release. Now what you're doing in that position is that because the nerves, your nervous system starts in your brain all the way up here, and it travels down your spine all the way to the nerves down, all the way down to your toe. So what happens is when you're in this position, you're lengthening the nerves, you're pulling on everything, you're stretching the muscles. Now, this is very important because you will most likely, if you already have nerve irritation and you do this move, because you are stretching the nerve itself, it is very common for you to aggravate the nerve. You're gonna feel either the numbness and the tingling, you might get shooting. So you wanna get to the point where it's more of a relief. And the relief, so you might have to back out a little bit. And I would start by backing out from your head. So instead of maybe doing your head, you could keep your head, but you can neutral, but you can bring yourself forward. And now if that's too much, then you can bring yourself out of it. Just that, some people will get a relief. You have to play with where you're gonna notice it the most. But the biggest thing that I find with a lot of people who do this exercise is it will stimulate the nerve. So you are gonna get that sensation. You can get shocking, you can get pain. If it continues, if it doesn't go away after doing it, if you don't get relief, if you're noticing that it's getting worse, please stop, abandon all this information. You need somebody, and I would need to know exactly what's going on and why that's happening in order to say, yes, continue or completely stop. So if you're noticing that pain, please stop. Like, do not continue. If you want to do a sliding move, it's a play on exactly what we just did. So it's that leg out, toe, but instead, so what you got to do, and this is going to take a bit of coordination, but what you want to do is instead of going into this stretching on both ends, you're going to stretch, let's say, only on one end. So leg is extended, you're gonna bring your toe towards you, so you're flexing this way, but now I'm this way, I'm looking up. Now what that's gonna do is where it's flexed is pulling the nerve towards that area. So this is called a sliding move, or some people will call this nerve flossing. So what happens is the leg is extended, you got your toe pointing up or towards you, and now my torso is the opposite way instead of that flexion. My head is back and I'm holding like this, and then I'm gonna start moving. So I'm gonna release my toe and then I'm gonna bring my head towards it too. So I'm releasing the toe, but my head is coming forward. And then I'm gonna bring my toe up as I bring my head up. So now what's happening is we're flossing the nerve. And that's a really good technique, especially if the nerve has become stuck. It's been like this for years. If you've been a chronic, somebody who's experiencing this for more than 6 months, these are really good tools and measures to be able to slide the nerve and get relief that way. But again, the same applies. If you're getting too much pain, worsening of the symptoms, you're losing other types of symptoms. Maybe it's that you're getting drop foot, or there's a lot of other things that can come along with this. If you're noticing these things, please go see a professional. Go get that properly assessed, because you need to know exactly what you should be doing and what you shouldn't be doing given your particular situation. Please give those a try. I really hope that you get some relief by doing some of this. If you need more information, I've made a bunch of other videos on sciatica, from stretching, low back techniques, things that you can do at home. So have a look at those. Don't forget to like, subscribe to the page, and share this information with people that we know need it the most. If you have any comments or questions, you can leave them down below. I always do my best to respond. And until next time, have a great day.